I'm Mike Spence, and we're back after the break on TSPN TV News in Depth with Ann Platt, our wonderful guest. We're going over different items related to the hospital and all the changes that have taken place just over the last year or so. And I know you've been working diligently on all of that data and digital input with all the hospital records and that changeover, and that was a major ordeal. And
yes.
you finally passed that. How did all that work out?
Well, we went live on an electronic health record in the hospital February 1st. And there was a lot of buildup, about a year of preparation around that for training staff, for approving order sets that would be hardwired into this electronic record. So it was very exciting. We had a number of our own physicians who became physician champions and received extra training to help their peers. We had nurses who became super users, and all of the training for the nursing staff and the other clinical staff was down in Sacramento. And the physician training, fortunately, we were able to offer on site. But it was very consuming of everyone's time and attention. We went live early morning on a Saturday morning, and we had about 50 extra people who were brought in from out of town to help at the elbow support with our staff to make sure that they could operate the new electronic health record and, you know, give them advice. And we were told by the outside folks who were there to help us that we had one of the smoothest go-lives that they had ever experienced, and
that's great.
Our staff were some of the most well-prepared that they had encountered. So that made us feel, yeah, that made us feel good. But yeah, it was rough going for a while, and we, of course, talked to our patients about it and explained to them why we were a little slower than usual in, you know, anything that we were doing involving their medical record. And the patients all really enjoyed it, and they seemed to appreciate that now their information would be secure and also be accessible to those who needed to know their information, because each patient in the Sutter Health system now has one medical record. So if you were a patient here today and you created a medical record here, and then for some reason you were down in the Bay Area and you needed to go to an emergency room, your medical record would be accessible to that doctor attempting to care for you in another Sutter facility. So that's really great for our patients, for safety, for continuity of care. And if you happen to have a Sutter Medical Foundation doctor who has Epic, which is the vendor of our electronic health record, then those records would be accessible if a provider needed them from your primary care provider, say.
Not only more efficient, but the communications is key.
Much better, yeah. Your history, your medications, your allergies.
If I went into, I can't even take Advil being on blood thinners and things. If you go into a new doctor and they give you, you don't know what they're going to do in terms of not knowing your history. So
yeah, so we're very excited about it. It's been a huge change, and as a result, we've changed additional processes and tried very hard to make things more efficient. And the staff now really like it. I mean, some staff immediately said, "This is great, I love it." Some staff were like,
resistant.
Well, this is hard, it's hard to learn something so new. And some of our physicians really were challenged because it's different. Everybody's used to just writing down what you want done, and now the physician order drives everything. And the physician orders are entered directly by the physician. So there's no confusion, there's no handwriting problem. It's the physician orders with a clear printout of
no
what
going
they
back
want.
to the old days, a lot of scribble, wondering who's
no,
talking to who.
No. So that's been a huge improvement, and very, very exciting for us. We're also getting soon a new technology for our mammography services. We will have, and you may remember a few years ago, we did our matching grant fundraiser for this new equipment, which has three-dimensional technology, and we will also be able to perform stereotactic breast biopsies right in the hospital radiology department.
How important is that? I mean, the technological change.
It really streamlines the experience for any patient, male or female, who might have a diagnosis of breast cancer. It's great that they can have the much more exact image and be able to initiate treatment much sooner.
It was harder for physicians to see and all that cloudiness and that imaging, and that 3D imaging is
it's going to be so clear.
It's a lot faster. You know, they used to spend a lot more time kind of guessing what they were looking at.
Right.
It's just, that's an amazing.
So we're working on all the permitting and the approvals that we need to get to install that equipment, and we hope to have that up and running soon.
That's a great example.
Yeah.
How do you keep pace with the competition? Is there any new competition that you see in health organizations? And looking at the hospital in Amador County, are we uniquely situated where you don't have a lot of that? Or?
Well, we're a sole community hospital, so we are the only hospital in our county. From that standpoint, we don't have a lot of competition. Of course, there are hospitals all around us, you know, Folsom, Placerville, Sacramento, San Andreas, so people can choose where they want to go. One of the things we feel strongly about is that if we're not able to meet a patient's need here at Sutter Amador, we have smooth transfer protocols in place within the Sutter system so that we're able to make sure the patient gets to where they need to be, and we don't try to hold on to patients if we're not able to meet their needs. So I think that's a strength we have of being part of the Sutter system. But, you know, there's lots of new disruptive technology. I mean, you can now have a doctor appointment on your cell phone. You can connect with a doctor, we call it telemedicine, you know, and you can do that with a lot of new technology. You know, I don't know about you, but I'm wearing my Fitbit.
I've got one on right now. I got my heart rate up checking these interviews, and I'm a little higher.
A self-help, you know, people are wanting more information about their health. And at our CEO breakfast the other morning, our president and CEO of the Valley area told the audience that he was at a meeting recently where one of the executives of Walmart announced that Walmart plans to get into the healthcare business and in 5 years be one of the largest providers of primary care in the country. Well, that's a lot of competition.
Right, sure,
that who would have thought Walmart wanted to get into physician services?
Well, it's one thing knowing what your heart rate is and Walmart gizmos, but it's another thing having someone be able to help you with that on a long-term health program and getting real quality care.
So there's all kinds of new technologies, new lab tests, new medications that, you know, I think the healthcare model as we know it is changing very rapidly, and along with that is the insurance funding of it. So in a few years ago, we didn't have many of the options that people have today, and in another 3 years, I think it's going to be a totally different landscape.
Yeah, I know obviously the Obamacare and all that has changed things, but we did have insurance issues that have been changed with Anthem Blue Cross and Blue Shield, and a lot of those coverages have been going through a transitional period as well. How is that working out with the hospital?
Well, it gets very confusing because people might sign up for a plan and then find out that their physician isn't in that network or our hospital isn't in that network. And all that shuffling happens at the end of the year as employers are choosing their insurance plans for their employees. And Sutter contracts with insurance plans based on the termination date of the contract, which they all seem to fall at the end of the year. And so it is confusing. It takes us a while to figure out because one company like Blue Cross might have 20 different plans that people, depending on who their employer is or where they live, signed up for. So you have to try to make sure that you're included in that network, or they need to make sure that their doctor's included in that network. And in Amador County, there are only 2 plans that offer Medi-Cal coverage. And one is California Health and Wellness, and one is Anthem Blue Cross. And we are contracted with Anthem and loosely contracted with California Health and Wellness, but that's created challenges for people.
I know, I went through that myself, the Anthem Blue Cross and all the changes, and the doctor,
Yeah.
Dr. Hartman, I told him I loved him to death, but I had to make a change.
You had to make a
And
change.
now I want to change back, now that they're, I think.
One, Dr. Hartman,
that's going
who's
through
year
changes.
after year
Yeah,
recognized as the best doctor in Amador County.
He's been a wonder. I want to take the last minute or two just to make sure people are aware. I always get your wonderful invitations to breakfasts and things, but the big event of the year that you hold at the Rancheria Grand Ballroom
Coming up.
each year is that big costume gala, and I have to call it a trip around the world. Is that the theme?
That's the theme this year, a trip around the world, and it's October 24th.
I'll put that up.
It's as we all say, it's the party of the year. It's so much fun, and it always is raising money for a good cause. This year, the proceeds of this event will go toward critical care ventilators at the hospital. And so,
wonderful.
Yeah,
Well, I know the
updated
Sutter Amador
technology.
Foundation is a big part of throwing that party. Marv Hampton heading that up this year. You're a great
Yes.
person.
He is, and
in
we have
charge
a
there.
wonderful board. And your wife is on our foundation
Well, yeah, I
board,
have to
and
disclose
she's
that, but that's, she
she's a
loves to serve,
wonderful.
and it's a great thing to be able to be a part of. And I'm just honored today to have you as a guest and learn more about what's happening over there at Sutter Amador Hospital. Thank you for coming on.
Well, thank you. It's a pleasure to be here.